Welcome to the Visibility Gap. I'm Dr. Jen Ashton. Throughout this season, we'll be tackling something vital, the women's health gap. Women have outnumbered men in the United States since 1946, yet they continue to face systemic disparities in healthcare, leaving millions without the quality of care they deserve. Women spend 25% more of their lives in poor health, an average of 9 years. And when it comes to research funding, diseases that primarily affect women often receive far less investment. These unseen disparities affect every aspect of women's lives, from their ability to work and care for loved ones to their overall well-being. In this season of The Visibility Gap, a podcast presented by Cigna Healthcare, we'll bring these hidden challenges into the light. From the long shadows of research inequality to the years it can take women to receive an accurate diagnosis. This season, we'll talk to inspiring women who will share their personal stories and expert panels discussing what it will take to create real, meaningful change. It's time to confront what's been overlooked and push for progress. To begin, today we'll hear from an incredible woman who described her diagnosis as bittersweet because it took 15 years of suffering to get there. Welcome, Marisa Zeppieri.
Hi, thanks for having me.
How old were you when you first started to have symptoms?
I was about 8. So when I was 8, we're looking at the mid-'80s. Mm-hmm. We never heard the word lupus. My mother and I never heard the word lupus. We never really heard about autoimmune disease. I feel like we were brushed off over and over again of just, she's a very fragile child. She has allergies. She's very thin. But there were so many clear-cut criteria for lupus that were just missed over and over again. We were also very low economic as far as monetary. We didn't have health insurance, and I don't know if that played a role back then, but it definitely limited the amount of medical care and the type of medical care that I could get. Maybe I would have had answers sooner. I'm not sure.
Some patients don't walk in holding a sign saying, I have this. Sometimes it really does require a lot of medical detective work that has to be predicated on respecting what the patient shares with you, trusting that the patient knows his or her body the best, and then working together as a team to get that answer. Did anyone ever tell you, okay, it's not A, B, or C. We're going to keep trying. We're going to keep looking. We're going to keep working together till we find an answer?
Honestly, no. No, it always was brushed off with asthma and allergies.
So now fast forward, you're given a diagnosis of lupus. Mm-hmm. As we now know, and this is not new information, autoimmune conditions tend to affect women in a major way more than men, disproportionately impact women. What did it feel like when you finally had the answer?
My diagnosis moment was really interesting because a lot of the symptoms that I had had at that point for 15 years all happened finally at one time. And I think if you're going back to what you just said, working with your doctor, it's very difficult with autoimmune disease when you might go into a doctor's office one time and maybe you have some low-grade fevers and you're tired. But the next time you have a rash, but you don't have any fevers. And it's sort of like you said, it's putting this puzzle together, right? I had a very specific trigger at 23 years old that I think is what sort of pushed my body to that brink. And all of a sudden I was in the hospital and it's like all of the symptoms happened at once. So by them sending in infectious disease, rheumatology, they started running all of these tests. I mean, probably over 100 different, diseases, some that we never even really hear about. But I was finally getting tested for everything. Mm-hmm. And within about 3 weeks, I had an answer.
And did you finally feel seen at that point? I mean, it must have been a mixed bag of emotions, right? Because on the one hand, there's fear and anxiety about all these tests that are being run, and what if there's this, that, or the other diagnosis. But on the flip side, was there relief that maybe you felt finally being evaluated or approached in a way that was appropriate?
Absolutely. I had a wonderful rheumatologist, and she sort of went through, things that she was looking for and talking to me about MS, RA, lupus, Lyme, and the infectious disease doctor. And I finally felt like someone was taking me seriously. They were able to see all of the symptoms that I had happening. I wasn't making them up. Unfortunately, they just all happened at once, so it was really bad. But when I used the word bittersweet that you had mentioned in the beginning, I remember the rheumatologist when she came in, and not that she was excited, but she was so confident, and she was, I guess, in a way, like, I finally have an answer for you. And so in that moment, it was like, okay, so I hate to use the word crazy, I don't like that word, but all of those years where you almost feel that way, here it is in one word, but in a bittersweet way of, I wish I would have had this information 15 years ago. Like, I wish you were in my life 15 years ago, because so many people missed it. But now that I actually know what it is, I can finally make a plan and move forward.
As the saying goes, most people can handle anything, but the unknown or not knowing is oftentimes worse. And that sounds like that was really your experience.
I would agree with that 100%. I think when I talk to other people now trying to go through a diagnosis, and I think about just what I went through, I think every patient deserves the dignity of a diagnosis, but we don't always get that in this world.
And how have you navigated work and career with respect to a chronic condition? What has been your experience with sharing? How much to disclose? How much to share? Particularly, let's say, in a work environment.
I didn't want people to look at me as the sick girl. I wanted to show them that I'm able to do this. I love my job. I work really hard. But the reality is it does affect. It affects every day of my life. And I realized the more upfront for me, I'm a pretty vocal person anyway. So the more upfront I am about what's going on with my body, needing off for treatment days, letting them know that I have lupus, what lupus is, if they're interested, that's worked the best for me, because I've been able to find career choices and employment where they will work with me. I know not everyone is in that position. I've been really blessed in that way. But for me, just sort of putting it all out on the table and saying, can we make this work? These are my limitations, but I make up for it sort of in, X, Y, and Z, right?
And you mentioned that at one point you had considered entering the healthcare field as a profession, as a nurse. My mom's a retired nurse, so a very admirable career, even that you were interested in that. With the intimate experience you've had with the healthcare system, what's your opinion of it today? What do you think goes well? What do you think desperately needs improvement?
I think the wait time with, certain diagnosis for diseases it's really out of control. There needs to be more testing, quicker testing. I think, in the way for doctors, knowing that most people wait months to see them, that 15 or 20 minutes, like as a patient, you are just waiting for that appointment. You can't wait to get to that appointment, and you're just hoping that they can help you. And I always tell people, like, take a list of your symptoms or things that have gone on, because that day you may not be, exhibiting all of those. But if doctors understood, like, that we've been waiting for so long to see them and to take us seriously and not, well, come back in 6 months and let's see if you're still having that. And it just pushes that time over and more and more. I wish something like that would really be looked at. I do feel that, especially in the last 5 years, because of technology and because of how much stories are getting out there now, that doctors are listening. Like, my doctors are incredible, and they understand, like, I do know my body the best. And so I know when something is lupus related, and I know when something is completely different. And I'm like, well, I'm not really sure. This has never happened before. This might be something completely different. And they listen to me now, and they're like, okay, well then let's do, A, B, and C, and let's get to the bottom of this. And I think it also comes down to, as the patient, advocating for yourself, being outspoken, really not taking no for an answer, or just saying, I'm not comfortable leaving here with that answer. Like, can we discuss this for a minute? Can we go a little bit further? Can I get this test, or can I see this specialist? At least ask. Don't leave there, just wishing that you had said something. Just speak up for yourself.
And clearly you are persistent and you are a fighter. How do you deal with the psychological or emotional consequences of what you went through? How are you not angry or ridden with fear and anxiety? What if this happens again? What if I'm not? I mean, you said you didn't feel like you were taken seriously.
Yeah.
How do you cope with that mentally and emotionally?
So if we had had this conversation, I'd say in those first 3 or 4 years after diagnosis, when I'd had a couple of strokes, I was learning how to walk again. The anger was at probably a level 10. I just felt like for so many years, so many bad things had happened. And you do get a medical PTSD. There is absolutely a PTSD
Correct.
element that comes along with this. And at some point, you are going to have to face that. And I didn't. We didn't talk about PTSD decades ago. I never heard about it. I just knew that I went from someone that never had anxiety to being angry and having full-blown anxiety attacks. And I didn't understand what was happening on top of like the physical symptoms that you're already having. Right now you're having these emotional symptoms. I needed to speak to someone. I've done counseling here and there over the years for stretches, and I've had to work through those emotions. And, what happened to me when I was younger, like, I would not want that to happen to anyone else. And it definitely set the stage for those years of my life. And I can never get that back. But I want to work through all of that now so that I'm not full of anger and fear and anxiety from here on out. I still get anxiety, I won't lie. When something's happening and I have to go to the emergency room, I think it's natural to sort of think back of the times that something major had happened and,
right.
Be worried that maybe something really bad is happening again. That's part of just living with a chronic illness. But I think it's learning the tools to get through those moments. And I've learned those through psychologists, reading, different workshops, and for me, just faith and a lot of prayer.
Well, you are incredibly inspiring and impressive, and I know that not just your story, but your spirit and your tips have helped a lot of people. So Marisa, thank you so much for having the courage and the desire to share your story.
Thank you. I appreciate it.
And to help us understand Marisa's story and dive deeper into the specific impacts the women's health gap has on businesses, I'm joined by two incredible experts. Dr. Margaret Rutherford is a clinical psychologist with over 30 years of experience, specializing in treating individuals and couples for anxiety, depression, and relationship issues. She is the author of Perfectly Hidden Depression: How to Break Free from the Perfectionism That Masks Your Depression. And Dr. Wendy Kline is a distinguished history professor at Purdue University and is a prominent authority in the history of women's health. Her latest book, Exposed: The Hidden History of the Pelvic Exam, marks her fourth major publication. Welcome to both of you. Thank you so much for being here.
Yeah.
Let's start big picture. Women's health gap. What do you think people don't know about it?
What I hear all the time is women will say, my doctor said I was tired, I was anxious, I need some sort of medication. And rather than actually listening, I'm sure you know this stat, but it's been proven that doctors actually listen for about 11 seconds to what you're saying. And then it becomes what's ever in their head and who the last person they saw, who's the next person they're going to see. Just like Marisa, you don't get listened to. And they will attribute any kind of even somatic symptoms as anxiety rather than perhaps actual medical problems.
I would say one thing that's really powerful about Marisa's story is the number of times she said, please take me seriously. Mm-hmm. And so I would say the takeaway that most people don't know is historically, after all, I'm a historian, but is how long that's been an issue. Women's stories, women's health has not been taken as seriously, in part because they haven't been listened to, just as you said, right? The expectation is they're just supposed to put up with what they're struggling with. They're not supposed to share those stories. And it's really only in the recent past, really since the 1970s, that the whole concept of patient advocacy and sticking up for yourself, asking the kinds of questions that Marisa learned to ask, started to happen. So it's a fairly recent phenomenon.
And because you are a historian, I can't resist but asking you to go back to what is one of the earliest pieces of evidence in history, is it with painting or literature or combination, of how women are often dismissed when it comes to their health and complaints?
Wow, that is a great question. Well, I am a modern historian,
okay.
But I can...
In modern history, how far back does it go?
Well, it goes back centuries, but the most obvious one, if you don't mind me speaking to reproductive health,
yeah,
is the fact that women's reproductive parts were hidden. And it was against medieval Christian law to look inside a woman. And so female sexual organs were mysterious and different and therefore taken less seriously, I guess, because the male standard was the norm.
But in bringing up uterus and to kind of coalesce both of your respective areas of expertise, the term hysterectomy, hysteria,
right?
It in women's reproductive health history. Explain where that term comes from.
Well, the idea is it's a wandering womb, right, that can't be contained. And so it goes through various manifestations. But in the 19th century, the assumption was the body is a closed, contained unit, and balance is really important. And so among women, the concern is if women are too actively thinking and engaged in mental work, the blood is being drawn away from the uterus. And that would be very dangerous, of course, and leads to hysteria, insanity, et cetera. And it's used as a justification for why women shouldn't go into higher education.
Or just think.
Yeah, exactly. So it's really embedded in our history, which helps to explain why it's so hard to then take apart, right? Because it's been around longer than modern attitudes.
So it's embedded in our history, and then it gets embedded in our psyche.
How do you think the fact that women seek medical treatment or seek mental health treatment more may confound how they're being treated? I don't know the answer to that question. I just thought of it.
Well, what I think is interesting about just that observation is that, first of all, in medicine and science and public health, it is important to make observations and then attach a frequency of those observations. You want to know, are you observing something that happens a lot, or are you observing something that's rare? But at the same time, we have to be careful not to generalize and force someone into a category that they may not fit in, right? So your question, Margaret, which I think is oftentimes talked about, is women seek treatment or diagnosis or attention for a complaint, whether it's mental, physical, usually physical, more so than men. But yet data shows us they are not taken as seriously. They face delays in diagnosis, delays in management, face less aggressive treatment options offered to them. And in many cases, in many disease situations, have worse outcomes for the same condition. Mm-hmm. The flip side of that, which I think is almost as dangerous, is to assume that men are always so stoic and that they don't seek attention. We can't, we have to be careful, and the pendulum has to swing in both directions. And I think that is as much of a problem in many ways, over-treating or over-assuming that just because someone's a man that they will do or not do something. But for women, we cannot continue to look at these statistics and just do nothing, right? Heart disease, mental illness, autoimmune conditions, pregnancy, maternal mortality, the list just goes on and on.
Sure it does.
So what do you think are obviously there's a plethora of risks that come with this gap for healthcare for women. What do you see as top of that list?
I would say it goes back to issues about power and legitimacy, like whose story matters. Again, I just have to bring us back to Marisa for a second, what she went through and for how many years, because she wasn't taken seriously.
15 years.
Yeah.
And when she started, what I think is interesting, and I would love to hear your opinion on this, Margaret, as a psychologist, she was 8 years old.
Yeah.
So not only was she not taken seriously, by default, it means her mother was not taken seriously as a parent.
Yes, I caught that and I thought, what in the world? I mean, it's one thing to believe there's some fabrication or the child might be too confused about what's going on, but her mother also was there. One of the things I kept coming to mind when I was listening to Marisa is I've been now a psychologist for a long time, but one of the best things I think, a best tool I have in my toolkit is when someone's presenting with a mental illness or mental symptoms, health symptoms, emotional symptoms, is for me to say, I need to think about this. I'm not sure. I don't know exactly what is going on.
That's the sign of a good doctor, of a good provider.
Right.
And then you can say, I don't know.
I do think we do people a disservice by, women especially, a disservice by not saying it could be, in my field, it could be anything from ADHD to bipolar. It could be, there are lots of things that these symptoms and these aspects of mental illness often coincide. And, you'll have a little bit over here and a little bit over here. And just knowing that very unique description or diagnosis of somebody that you're going to treat is just so important for you to take your time.
Mm-hmm. And as I always say, you can have more than one thing going on at a time.
Exactly.
Yeah. Can I jump in for a second and just talk about how, so many health issues that women struggle with, women and men, but in this case, women, are complicated. They involve potentially psychological, physical, lupus has been hard to diagnose. And they require listening to the patient, right? Because so much of this is subjective. What are you feeling? The problem is, as Marisa experienced, you start to doubt yourself if people stop listening. You pointed out, 11 seconds?
Mm-hmm. 11
right?
seconds.
So we are kind of conditioned from a very young age to not necessarily believe in ourselves, but believe in the expert. Expertise is all well and good. Mm. But when it comes to substitute for to listening to your body, which she kept saying, I need to listen to my body. I am the authority. Well, for centuries, we were told the exact opposite. You don't know what's going on with your body. Only your doctor can really tell you that. And so particularly in complicated questions where you can't do a biopsy or there isn't a clear-cut case that leads to a diagnosis, it requires a conversation, a dialogue, and respecting that the person knows what they're experiencing. They know their body better than anybody else. And that doesn't really happen until we get the women's health movement in the 1970s.
And how much progress or lack thereof do you think has been made since the 1970s?
That is a tricky question. I will take it both ways and say the one really important thing that most people don't know about this is when we talk about patient advocacy, regardless if it's about women or men, but in general, this idea that a patient has a right to speak up for themselves, that is a direct correlation to the women's health movement. Because up until then, where did you get information, right? it was in medical textbooks that were written for other experts and that were intentionally made to not be accessible to the lay reader. You couldn't Google something, right? And it's in the 1970s when we see the emergence of Our Bodies, Ourselves, and these books that are written by women, for women, with the idea that, of course, this information is accessible, right? We can do our own research, we can understand our bodies, and we can teach ourselves. We don't need to disrespect the expert, but we can have access to that knowledge as well. The final message is we are the authority of our bodies. We know our bodies better than these doctors do, and we have a right to speak up. And that message really ended up transforming the doctor-patient relationships because people realized they had that right to speak up.
What factors do you think make the gap for women in healthcare worse? Race, geography, socioeconomic, or all?
Gosh, all for sure. It's really hard to compartmentalize. I think it's important to recognize that all of them play a part. And that gets me to answer. I didn't quite answer the other part of your question, which is what hasn't changed. And I think what hasn't changed or has gotten worse is directly related to all of those factors. We know from Marisa's story, they didn't have health insurance, right? So class and economics plays a huge role in access to good health care. Race clearly does as well. All of those, there's so much evidence about racial disparities as well playing a factor in here. It's hard to compartmentalize. As a women's health expert in terms of history, I would still argue that we're all here today because there is such a clear gap, generally speaking. Even when you take all of these other factors into account, there's something about women's health care point blank that is problematic. So I would probably still put that at the center of my list.
We heard from Marisa what things helped her along her process and her journey with getting a diagnosis, but then even subsequently to living with a chronic condition. We also heard about the things that did not help. We know that she had a very supportive mom, has a supportive mom. Obviously, friends and family are very important. What about the role of the workplace? Employers, managers, supervisors, coworkers. How can that help or hurt women in particular who are trying to navigate the health system?
Well, I think information and the fact that the corporation, the company, however large or small, gives attention to those things, gives attention to mental health, to medical help, and gives the idea, the zeitgeist of the company is one where we want you to take care of yourself, no matter whether that's physically, medically, mentally. And
well, we want you to take care of yourself, and we will help take care of you too.
Also, I think going back to Marisa, it's also about identity. She is obviously more than her condition, and I would never, but she kind of embraced that. I am who I am, partly as a result of what I've been through. And so kind of to the point that the individual wants that knowledge shared or known, that is part of their identity. That's how they approach perhaps how they approach their job, how they think about the world. And so kind of embrace that that's part of who they are and respect it, I think is really important too.
And I would just add, we're talking about the women's health gap, but men need to be involved in this solution and this discussion, and a lot are, which is fantastic, but it's not a women-only, let's circle the wagons situation. This is a human issue that men and women need to participate in.
And it's always this kind of slippery slope, right? Or once we start focusing on a particular group, does it reinforce stereotypes in the end because it becomes a women's issue and therefore, in this sense, is therefore less important? Or is it something in which we model something that then could be embraced by other groups, which is just going back to the women's health movement, that idea of patient advocacy started as a women's issue, and it really became an issue for everyone. So I think the message that we may focus here, but it's a model that everybody could benefit from.
Well said.
Thank you.
Dr.
well
Kline,
said.
Dr. Rutherford, thank you so much. I think this is just the beginning of the important issues that are all under this umbrella of the women's health gap, and the insights and perspectives that you both shared, I think, are so powerful and so interesting. So thank you very much for being here and part of it.
You're welcome.
Thank you.
And thank you to our listeners. We hope this episode of The Visibility Gap has helped you and your loved ones feel seen and empowered. If you found it valuable, please don't forget to share it, like it, and subscribe to stay connected with us.